Okay, as you move forward in developing your methods section, it's important to pay a lot of attention to measurement. Um, your method section needs to include any procedures for controlling for confounds and measurements. So we'll talk about confounds a little more and how we can be aware of situations that might result in confounds and how you can adapt your procedures so that you can control for those. We'll also talk a little bit more about defining target behaviors, and then we'll review some of the nuances of inter-observer agreement. I know that you've got a familiarity with different ways of computing or calculating inter-observer agreement, but it can be a little tricky. You have to use the right formula for the right situation. There are also a couple of other things related to inter-observer agreement that I want to introduce at this point. So let's talk about confounds and measurements. So, of course, if you haven't done so, review that PowerPoint from last week, or I think it was on the materials for the 19th, um, or the week before that, related to measurement. It's just a review of duration, latency, momentary time sampling, partial interval, whole interval, all that stuff. So review that. We're just going to assume that you got that background as we move forward at this point. So let's talk about extraneous variables and confounding variables. Well, extraneous variables are things that are present in the environment that will affect all the conditions of an experiment. So things like the lighting, or how crowded the space is. Um, I once was doing a research study when I was in Utah. It was one of our master's students was looking at what was she studying? She was looking at different ways of identifying reinforcers for kids with emotional and behavioral disorders, and this was in an elementary school. Well, her classroom was off the gym, so it was like, seriously, it was probably originally a weight room or something, and they had turned it into the little EBD classroom at this elementary school. So you opened her classroom door, there was a gymnasium. So part during certain periods of the day, kids were other classes were in the gym playing basketball or having PE classes, blowing whistles, and it was just really insane the amount of noise in their classroom. So one of the issues that we had to look at was the impact that that extra noise would have on the student's ability to focus. So let's talk about that in the context of being an extraneous variable versus a confounding variable. A confounding variable is something that is not directly controlled by your study, but it might influence your dependent variable. So when we talk about extraneous variables, we're talking about other things that may be present in the environment. Confounding variables are usually things that might have some association with one of your conditions. So, for example, let's say that basketball was being played in the gym in the morning, and let's say she was comparing two methods of identifying reinforcers. One of them, she was going to do an adapted alternating treatments design, let's say, and so she was going to have one condition in the morning, another condition in the afternoon. Well, if she always used one, let's say that she used a function-based method. So she would do a functional assessment. Kids who had escape-motivated behavior, their reinforcer would be something like getting time off work or buying themselves out of work. Students whose functional assessment indicated access to attention as a reinforcer, they would get some form of attention as a reinforcer. So and then the other condition would be based on just the teacher picking stuff, rating what he or she thought the kids liked. So let's just say those are the two conditions. Well, if our condition in the morning is always the function-based reinforcer identification method, and if morning is when basketball is being played, the basketball noise level in the gym is a confounding variable because it's affecting one of your conditions and not the other. So it can influence the dependent variable. Let's say the dependent variable is on task, percentage of intervals on task, and work completion, a permanent product measure. Well, the effect of that noise could impact that both those dependent variables, and it's not related to the independent variable, which is method of reinforcer identification. So that's a confound. How do you control for that? Well, one simple way to do that, since we can't change the gym schedule, is we counterbalance those conditions so that each one of them is equally occurring in the morning and the afternoon. So we might, in a semi-random fashion, alternate on days. So that's one way of doing it. Extraneous variables, you have to be aware of them. They can influence the outcome of your study, but they're probably going to affect all the conditions equally. So extraneous variables might impact what we call external validity. That's the extent to which our results can be generalized to other situations. And that's the goal of research. With research, we're looking for principles that can be applied across situations. That's why when some of you wrote research questions that were, I'm interested in the effects of group contingencies at Hawthorne Middle School in Lake County, just made up those fictitious places. That's not a research question. That may be your setting, but the goal of research is to uncover principles that can be applied across situations. The extent to which your study can do that is related to external validity. Confounding variables are related to internal validity. Internal validity is the extent to which your changes in your dependent variable are due to your independent variable and nothing else. And if you have controlled for things like confounding variables, your internal validity is going to be higher. And we'll talk about these concepts of internal and external validity more. But extraneous variables and confounding variables are things that you have to be aware of. As a researcher, you have to get develop a good eye for picking up on those things that might be present and then coming up with a way to control for them so that they don't influence your outcome in a way that you can't predict or interpret. Thought I had a slide for each. We'll just talk about it. Observer drift. That's when you start out training your observers in behavioral definitions and recording procedures, but over time, an individual observer might start changing his or her definition. And usually this happens without the awareness. So I'll give you a good example. Let's say that you're looking at the quality of social interactions of kids with disabilities. And in the beginning, you've got a kid, let's say in baseline, who does not interact with other children at all. And then you start teaching social skills, and this kid starts initiating interactions and engaging in exchanges, reciprocating social initiations of other kids. And so let's say that in the beginning you define a social initiation as you approach another person and you communicate something, you make a request, or you state something. So it's like there's some exchange. It could even be offering a toy to share, or it could be say, "How are you?" or "Can you help me?" or something. So you may have several different behaviors that are in that response class, but you come up with a good definition of a social initiation. Over time, as the student improves and their social initiations become more elaborate and more complex, sometimes what happens is the observer starts not counting real simple initiations that would have been scored at the beginning of the study. In other words, it's sort of like a shaping process where the observer says, well, I would have counted that back in week 5, but now we're in week 6, so I expect more out of this kid. Well, that's if you're looking at changing a criteria for reinforcement and that's part of your intervention, that's fine. However, if your outcome measure is the frequency or rate of social initiations and you change what you're calling initiation over time, that is affecting your measurement. so that you're actually not measuring all of the progress that the kid's actually making. And you would deal with the quality in a different way, and maybe you even have another measure that indicates the quality, or a rating of some sort, but it's critical that that definition doesn't change. And we're all guilty of that. That's not the hallmark of a bad observer. That's simply, we just do that. Well, how do you prevent that from happening? It's important to continuously review your criteria. Um, and that's why you need repeated measures of inter-observer agreement. And it's not uncommon for an inter-observer agreement to start out really great, and then after a period of time you do a check and it's lower, and it's like, whoa, what's going on here? That's when you review your definitions again. So that's that's uh, that's something that you just have to deal with when you do observations, and it's actually something that you need to be aware of when you're collecting data on students, or if you have paraprofessionals or behavioral technicians collecting data. Be aware of observer drift and check on the reliability of your measures periodically. Even if you're not doing a research study, it's really important just for good data practices. Reactivity is when the presence of an observer, or the presence of the presence of an observer, a data collector, affects the behavior of the participants. Well, we're all aware of that. You go in, I mean, my as being a behavioral consultant for years, it's real common that, I go to observe a kid, and the kid knows that I'm there to watch him or her, and so their behavior is different that day. How do you control for reactivity? Well, one of the practices that most researchers do is they'll start out just observing or being present without actually counting data. That works really well often with with training observers. So before you actually start collecting data that you're going to use, you practice. Some of that practice can be done with video, but some of it needs to be in the actual setting, because there may be issues related to collecting data in the actual setting that you won't experience using video in a separate room. It's also, with the video, you can stop and you can talk about it, you can replay it. So it lends itself really well to training, but it's not really a good test of how reliable those measures are in the real world. So I like using video for training, but I don't use it to assess my reliability of my measurement system. That has to be done in the actual setting under the conditions in which you're going to conduct the study. The other benefit of that, as I was saying, is if you're practicing in the actual setting, you're also exposing the participants to the presence of the observers, and they're habituating to them. You get used to them being there. It's different with different settings. I work in a couple of settings, therapeutic day school that I've done a lot of work in. Those kids are so used to outside observers coming into classrooms, they hardly notice you. They're after class, they may come up and ask you who you are, or they don't ask me that anymore. They know who I am. But um, so reactivity is less of an issue there. In other settings, it's a real issue, and it's something to be aware of. The other is observer bias. This is different from observer drift. Observer drift is more insidious. It's when someone changes the definition over time, often again without being aware of it. Observer bias, well, people are sometimes not aware of that either, but it's when the observer is, oh, usually it's when you're aware of the hypothesis of the study. Of course, this is always the case with me because I'm often collecting my own data. Um, Ideally, in a perfect world, if you had observers who were naive to the actual hypothesis or desired outcome of the study, that would be perfect. You just got people and they're trained to observe and collect data, but they really don't know the purpose of the study, or they don't know the direction or which way you would really want the data to go, and they're just objectively recording data. Um, I think that only exists in textbooks, or maybe in medical studies, I'm not sure. It's really, someone's always going to be aware of the nature of a study in a applied behavior analysis settings almost always. Usually it's a problem behavior that you want to decrease, or it's a skill that you want to increase. But there's this tendency sometimes for people to bias their data to make it more favorable for the outcome of the study. And sometimes people who are conducting research can facilitate this without being aware of it. For example, let's say that someone records some data and brings it, and you look at it, you review it with the observer, and the data is really favorable. And you're like, this is awesome. You did such a great job. These are awesome data. This is going to look great on the graph. And then another day the person records data and it's really crappy, like the kid did not behave in the way that you had anticipated, and like, oh well, this is really tough. This is going to mess up our graph. And so you could actually differentially reinforce the observer for providing data that best fits your hypothesis. So you have to be careful of that, and you have to be sure that you're actually giving feedback for accurate recording. Yeah, you did a great job capturing all this. So does the data actually, the behavior you want to reinforce in observers is, does the data reflect what actually occurred? And so that's good objective data recording. So again, how do you control for that? Good inter-observer agreement is still the way that you assess that, and then the way that you would control for it would be more observer training. This is more of an issue with self-report data. So sometimes if you just have people on the site collect data, often it's prone to observer bias. But again, it's the importance of inter-observer agreement. Now let's take a look at confounds that are not related to measurement, but related to the actual independent variable or the intervention. So let's say that part of your study is looking at function-based interventions. And let's say that in your observation you see that someone's actually getting attention when they're getting access to a tangible. So this is a common problem with direct functional assessment measures. Remember, direct assessment is when we're just observing things as they occur in the real world, and we're not controlling as in a functional analysis or doing environmental manipulations. So a big problem with functional assessment, direct assessment, is it is full of confounds. So in this case, the consequence of the behavior is the person gets access to something tangible. So they get access to a game or some toy. At the same time, they're getting attention. So those two variables are happening together. Or let's say you're doing a functional analysis condition and it's an escape condition, or let's say you're doing an attention condition. I guess it doesn't matter, and the person's also getting escape at the same time. So you're intending to assess one variable like access to tangibles or access to attention, but at the same time the person's getting something else, escape. So again, that happens all the time with direct observation, and that's one of the weaknesses, is the confounds that are built in. How do you control for that? Sometimes you can put blind control procedures in. So in other words, you describe or you set up a condition for how people are to respond, but the person doesn't know the purpose of it. Again, in medical research, they use like blind controls. You don't see them as much in applied behavior analysis and special education. We control for confounds by again cleaning up the procedures. So that would be where we would come in and we'd retrain people who are implementing. Okay, you're giving a lot of attention, at the same time you're giving access to tangibles. This is the way you have to present them. You have to minimize the amount of attention and give access to a tangible, or you have to be sure that you're not providing escape when you're also giving attention. Sometimes confounds are related to the participant, or if we use the old language, subject. Um, One of the threats to internal validity is maturation. So maturation are changes over time that are not related to the independent variable. For example, if you're working with young kids and you're doing a study on language development and your study takes place over a 6-month period, you've got real maturation in that the language abilities of a child that's 2.5 or 3 years old, those skills are going to change dramatically over a 6-month period. So if your study is looking at facilitating communication, you have to have a way of control what changes in communication skills are related to your intervention and not just the kid being exposed to more communication and just natural development of language. And there are different ways you can do that. That's a pretty extreme example, but what we can often see are just changes in exposure to things other than our independent variable. And the example I used before, I'm just going to use it again because it's a really good one. The study that Erica Pinter and I did with the participants at the gymnasium. They went once a week. Because we only got one data point a week, the study took a year to do. Over the course of a year, we had to be very concerned that they weren't just watching other people working out in the gym and learning how to use the machines that way. The way we control for that was we used a multiple baseline across participants and also across machines. So if they were just learning from modeling that was taking place naturally, we would have seen an increase in their ability or their independence on some of the machines before they got the video modeling instruction. And that's how a multiple baseline controls for that. You should expect to see a change only when the independent variable is introduced and not before. And all the single case designs have a different way of controlling for the maturation and other threats to internal validity. The other issue is something called repeated measures effect. So in single case research, we use repeated measures. We don't do pre-post types of measures very often, but we look at repeated measures over time because we're interested in trends of behavior. We're interested in patterns of behavior as behavior analysts. However, being exposed to a measurement over time can sometimes affect the behavior of the participant in a way that we didn't anticipate. For example, let's say that you're teaching a skill and you're using a multiple baseline across behaviors or across skills. So you have 3 tasks that you're teaching someone. Let's say they're vocational tasks and they all involve a chain of behaviors, and you're using an instructional procedure. Let's say you're using simultaneous prompting. That's a prompting method that's used sometimes with individuals who have a lot of prompt dependency. So you use simultaneous prompting and you want to test the effect on 3 different vocational tasks. That means that that third task is going to have a very long baseline period because you first have to implement the intervention with task 1 and task 2. And that's one of the things to be concerned about with multiple baseline is by the time you get down to the third behavior, the third setting, or the third participant, you've been recording baseline data for a long time. You have to be careful. Sometimes the way we collect baseline data with a chained task is we might actually set up the next step in the chain so that we can assess whether or not the person's learned that step. And if you're not careful, the fact that you're setting up that task for the next step is actually modeling the skill to the participant. So you have to sometimes do weird stuff like have the person look away while you set it up, and that can get a little old after 2 or 3 weeks. And if the participant's verbal, they like say, "Why don't you let me watch?" or something like. I've had people get a little annoyed with me. So that's an issue that you have to worry about, and is a fact of life with repeated measures. You have to be careful that your measurement is not affecting the outcome in some way. So, doing research in an applied setting, you accept the fact that confounds are going to be there. That's just the reality of the way we do research. And I wouldn't have it any other way. I'm only interested in doing research in realistic kinds of settings. And the reason is, I think the external validity, the extent to which the outcomes of research can be applied to other real settings is higher. So I think it's a price worth paying. It's applied research is never going to be as clean as something like Brian Iwata's research on functional analysis, where he has three rooms painted different colors, and there's absolutely nothing that's going to happen other than what he's planned. Well, the price you pay for that is you have an intervention that may not be generalizable to real world settings. So you're aware that you may have confounds, but you keep it as tight as you can. Control for things you control. Be as consistent as possible. And when things happen that may affect your study, you document them very carefully. Because it's important to things that you can't control for, you have to report in the results of your study, and you discuss it in the discussion section about how this may have impacted you, and then you plan how in another study you might overcome it. So that's an important part of the research record, or a list of potential problems you might run into. So when I'm doing a lit review like you're doing, and I'm reading a collection of studies about a particular topic, I pay a lot of attention to problems and issues that the researchers ran into. Another confound you have to watch out for is bootleg reinforcement. For example, it's someone inadvertently reinforcing a behavior when it's not part of your intervention. So sometimes this is unintended. Somebody's responding in such a way that's giving attention to a kid. Sometimes it is intended and the person just doesn't quite realize that it's not part of the intervention. Either way, you have to sometimes do extra staff training or extra modeling to make sure that the intervention gets implemented with fidelity. So let's talk a little more about external validity. When we're talking about controlling for confounds, we're usually talking about internal validity. Internal validity is the extent to which changes in the dependent variable are due to changes in the independent variable and nothing else. And we do all kinds of things to ensure that's the case. That's the reason that single case designs are constructed the way they are. External validity is the degree to which our results can be generalized to other settings, other groups of individuals, or other behaviors. So how generalizable are our results? So in other words, will the functional relationship that we were able to establish in our study hold to other situations? External validity is never perfect. Every study has compromises. We compromise internal and external validity to be able to accomplish the research and address the research question. Some studies have more external validity than others. What affects external validity? Well, doing your research in a natural setting and the extent to which your research was done under the conditions in which those participants usually obtain treatment or education increases the external validity. So I'll give you two scenarios. One of them, let's say that we're looking at the impact of using wearable devices to assess anxiety. Let's say that's something that I've been involved with lately. So one study we could do it in a public school setting, but researchers could go in and actually do all of the interventions, all of the assessment, develop the interventions and implement them. that would have more external validity than, let's say, we had done the research in a clinical setting. Participants, people brought their kids to like an office building, and we had a research room set up, and we did the assessment intervention there. Well, doing it in a school, even if the researchers are doing the intervention, is going to have greater external validity than the clinical setting. However, if we have school personnel, teachers, and paraprofessionals who work in that setting actually deliver the intervention, that greatly extends the external validity of the study. You can be assured that the results are more generalizable to uh, school settings at any rate. The With single case research, since we do deal with small n's, small numbers of participants, we rely on replication to really establish external validity. So it's when studies are replicated across different settings and situations that we can build the external validity of a body of research. So replication is extremely important in single case research, and the reason it's important is because of establishing external validity. Let's talk a little more about replication. So if you copy a study, let's say you take a study and you implement it as closely as possible as you can from the method section information, that's a direct replication. Those are important, especially early in an area of research. Let's say that, um, I'll give you an example. I did a study when I was a doctoral student, and we looked at the effects of negative teaching examples. In other words, on one condition, I had one negative example of the concept, and then another condition, I had like multiple examples, like 10. And what we found was that we could get away with fewer positive examples if we had a lot of negative examples. So it was really a study that was suggesting that negative examples are more important than people had thought. So that study had results that were different from what other research had shown. So it would be important to do a direct replication of that study. And it was one of those things I wrote up in the method section. It's important to do a direct replication. I've never done it, so it's actually something I may get around to do. Um, Other types of replications, the purpose is, okay, this finding was we've the researchers found a functional relationship with middle school students with emotional and behavioral disorders. How would this apply to elementary students with emotional and behavioral disorders? Or the research was done in an alternative therapeutic day school. How would it apply to a public school setting? Or this study was done with middle school or adolescents on the autism spectrum. What about with elementary kids with emotional and behavioral disorders? So you can vary one aspect of the study, and I think that just based on the questions, many of you are doing something like this. You're taking a study that you read, and you're wondering if it will apply to a different age group, a different setting, a different disability, or maybe you're varying one aspect of the intervention itself. So those are called systematic replications. That is a huge percentage of studies that are done in the single case research literature are systematic replications, and by changing some element of the study, we're expanding what we know about that particular phenomena. Another issue that we have to be concerned about research is treatment integrity, the extent to which the intervention or the independent variable was actually implemented as planned. And this is a huge issue in applied research. We simply can't assume that because the intervention was, people were trained to implement it, that it was actually carried out the way it was planned. Um, in describing treatment integrity, you often see the term treatment drift. So this is A little bit different from observer drift. With observer drift, the observer changes the definition or the way that behaviors are being scored or recorded. With treatment drift, the intervention itself actually changes over time. Often we will change interventions in a study. If something's not working and the data shows that the participant's not responding the way that we plan, we will make a change and we'll draw a line on the graph and we'll label the change. However, it's a problem when changes occur without the researcher's knowledge. Now, just like observer drift, sometimes this isn't intentional. Sometimes people just sort of start evolving or changing the way they're delivering the intervention, or sometimes people will start to throw in interventions that they've used in the past. I had a personal experience with this. I was doing a study in a high school setting, and the one of the administrators was interested in being involved with research, and she said that she could implement some of the sessions herself, and she had asked me to do that. So I worked with her, and I modeled how to implement the intervention. And we scheduled some days when I was going to be there and some days when she was going to take care of it. Well, what happened without my knowledge is she got busy, or she decided that she didn't want to commit to implementing the intervention at the times that we had agreed. So she taught one of her assistants to do it. And something was lost in transition. So I showed up to do inter-observer agreement, and the assistant was implementing the intervention, and she was not doing it the way that I had trained the administrator. And she was collecting data in such a way that was not consistent with the way we've been collecting data. And then when I tried to talk to her about it, she sort of got angry, annoyed with me. She wouldn't say angry. She got annoyed and basically, I know what I'm doing, and Miss So and So taught me how to do it. It was like, okay. So, so I had to actually throw out a lot of the data and redo some aspects of the study, which really hurt the study because the person had already been exposed to some weird variation of the intervention. Sometimes it's simply failure to implement the intervention. So the people will say that they're doing one thing, but in reality they're not. So that's why measures of treatment integrity are important. Treatment integrity measures or fidelity measures measure the extent to which the intervention was actually implemented. Okay, let's shift gears for a second. Let's look at some different situations. So um, if we were actually together in class, we'd go through each of these and I would give you the scenario, and then you tell me which design would best apply, a multiple baseline or reversal design. Let's kind of do this on your own. So let's say the first one, you're going to implement an intervention sequentially across participants. Which design would you use? Next case, you're going to assess different techniques, DRO, DRA, and DRI. What design would be appropriate for that? And again, we're just looking at multiple baseline versus reversal. Got several options that would work there. Let's say that you are going to do a repeated reversal of an intervention. Which design would work best? Suppose that you're going to do multiple probes. So you're teaching a skill, you're not assessing during instruction, but you're doing probe sessions once a week. What design would fit best with that scenario? Suppose that you are comparing multiple treatments. What design would work? Again, with the choice between multiple baseline or reversal. There are other options you could use there as well. Suppose you're going to assess the effectiveness of non-contingent reinforcement. What design would work? Suppose that you are doing a study with several participants, but one of the baselines is going to be delayed. What option would work there? Suppose that you're implementing an intervention sequentially across settings. So let's look at so I suspect most of you got these, and they're certainly anything that you would use a reversal design for. You could also use an alternating treatments design usually. And then there are different variations of a reversal design, like the BAB would be you start with an intervention, then you do baseline later, and then you do intervention later. That's an interesting one. It's typically done in situations where there's an intervention already in effect, and you want to impose a baseline and then reinstate the intervention. Not used very much, but in some situations it can make things less complicated. The reason being, let's say if the intervention is already in effect, and let's say you want to use an ABAB design, you're it's very risky because you say, okay, we're going to stop the intervention, then start collecting baseline data. At that point, you don't know what impact the previous intervention had is going to have on your baseline. It may not return to baseline. So it's in that situation, it's probably more honest to do a BAB design. Let's talk a bit about selecting target behaviors. So if we're actually not trying to address a research question, but we're actually just looking at behaviors that we're going to change, um, the priority is always which behaviors are a threat to that person's health or safety. In other words, what behaviors are actually going to um, interfere with that person being, healthy, living a normal life, or safety of that individual or other individuals in the environment. So aggressive behavior may not threaten the individual whose behavior you're going to change, but it certainly would impact everyone else. Where self-injurious behavior or even something like hand mouthing can affect the health of an individual. The next category we look at with prioritizing targets is the frequency of the behavior. Um, is it something that the person, is it a skill rather that the person is going to need frequently or often? The example that I was taught many years ago of a functional skill is if you don't learn how to do this skill or engage in this behavior independently, will you have to pay someone or will someone have to be paid to do it for you? Um, and then it's related to frequency. So, for example, if I can't brush my own teeth, and if I can't dress myself and bathe myself, someone is going to have to be paid to help me do those things or to do those things for me because those are things that are important for my health. So, it's critical if I have the ability to do those skills myself that I learn how to do them. Preparing my taxes, well, that's another example of if I don't prepare my taxes myself, will somebody have to be paid to do that for me? And the answer is yes. Um, Laura and I have I do some consulting on the side. She does a dog training business, so our taxes are a little more complicated now than they used to be. We used to do them ourselves. Now, because of the her dog training business, especially, we have expenses related to that business that we have to factor in, and we bought a property with a building on it for dog training, so we're able um, to deduct part of our payment of a property for business purposes because it was purchased for business. So, not to bore you with those details, but it's too complicated. We could probably learn how to do it, maybe, but it's not worth it to us. Since those that only have to be done once a year, we just pay somebody to do that for us. So that's a good example of prioritizing functional skills anyway. Occurrence of a problem. So it may be a problem that is not a threat to the individual, but it happens at such a high rate that it's really interferes with learning of that person or other people, or it affects that person's independence. For example, stereotypy is a good example there. Let's say that I engage in some kind of repetitive behavior like body rocking or head turning, um, And it happens at such a rate that it interferes with my ability to attend to and learn. So it's significantly impacting my independence. That's much more of a priority than stereotypy that occurs just when the individual is excited about something, or if it's like a transition time, the person's not doing anything else, so they start engaging in some kind of stereotypical movement. That's a much lower intervention priority. So, does it does it occur to an extent that it impacts learning or independence? And then the other factor I would throw in there is to what extent does the behavior socially stigmatize the person? That's related to to developing relationships, to interacting with other people, being included, opportunities to learn new behaviors. If a behavior is going to change the perception other people have of me to such an extent that they're going to avoid interacting with me, then that's a high priority. My very first job, I worked with this really cute young guy. He was really just a really sweet kid with severe disabilities, and he was extremely social. He loved people. He loved meeting new people, interacting with people. But he had this hand mouthing behavior. He would stick his hand in his mouth, and it would stay there for long periods of time. So his hands, he always stank. He smelled bad because of his hand being in his mouth, and it was all over his clothes. And he would reach out to touch somebody with a slobbery hand, and people would just step back. Nobody wanted to be touched with it. I don't blame them. So that behavior, of course, it impacted his health because it's not sanitary to put your hands in your mouth. And he did it so much that the skin would actually break down. But it certainly interfered with his ability to develop relationships with people. It affected the perception other people had of him. So that was a very important priority behavior to change for him. The other issue is longevity. The behavior that you're changing, is it something that is going to benefit that period across time? Or is it something that's very specific to a current situation that isn't necessarily going to be important to that person at another point in time? For example, let's say that you have a high school student with significant disabilities who's about to transition into another kind of program, and let's say in 6 months, and people decide that an important goal for that person is navigating that building, learning to get from one instructional area to another at transition times. Well, that would be not a high priority because that's a skill that's very specific to that particular location. It would make more sense to teach that individual a skill that's going to be useful in the subsequent setting. So, when I used to work with adolescents on the autism spectrum, we spent a lot of time looking at the environments where those people were going to live. Were they going to live in a group home? Were they going to have a job in the community? What skills did they need to be successful in those settings? Other skills, just by their nature, are important across a lifetime, like communication skills and social skills. Those are skills that are going to give that person the opportunity to access other sources of reinforcement and give them a level of independence that they wouldn't have if they don't have those skills. And as I look at this slide, I see I've already hit on a lot of these things. So, uh, is the skill important to skill development and independence? We've already talked about that. Uh, does the behavior cause that individual to get a lot of negative attention? In other words, is the person in a pattern of behavior that they've learned to engage in problematic behavior to get attention from someone? And of course, teaching that person more appropriate ways of interacting with other people and accessing attention is going to benefit them over a lifetime. Um, Also, another factor is to what extent is the change in behavior going to reinforce significant others, other people in that person's life. So we come back here to the concept of social validity, and we're going to deal with that in another session later on. But social validity is the extent to which other individuals in the environment view that behavior change as being important and significant. And this has become an increasingly important measure in applied behavior analysis. So it's not enough that we can show a nice functional relationship on a graph, but the people who are actually in that setting who have seen the behavior change, to what extent is their perception that that change has benefited this person? So, almost any research study that you submit for publication, the reviewers are going to expect that you've included a measure of social validity. Other things we consider when we prioritize behaviors are the likelihood of the success of the intervention. So, this is determined to what extent does research show that this intervention has been successful with individuals who are similar in similar situations. So, remember the external validity piece. Based on your experience or experience of your coworkers, to what extent do you expect success? It could be that, and this is related to the environmental variables and the availability of resources as well. For example, when I worked at the New Jersey Center for Autism, it was an intensive treatment setting, and we had a very low ratio of students to adults. We had, I think we was in some situations 1 to 1 or 1 to 2, because the needs of those students were so intensive. A lot of the interventions that I used there, I did not use in subsequent settings, and I had to sort of learn to uh, to adapt the way I designed interventions, because I didn't have the level of resources that I had. So for example, we could do analog functional analysis sessions, and we did that really frequently. Those are not that's not an intervention that I would use in a school setting, and I wouldn't do research related to analog assessment. I'd use something else like trial-based assessment or in vivo assessment. You also have to consider the cost benefit analysis. So, what's the bang for your buck? Is the intervention, not only is it going to be successful, but are the gains going to justify the cost? And the cost not only in money, but in resources and effort. And sometimes the answer is no. Like, we could change this behavior, but it would consume so many resources that we wouldn't be able to teach this individual as much, or we wouldn't be able to teach others in the environment as much. So you have to consider the potential benefit, not only immediate but long term. And does this intervention justify it? So it could be that we'll choose another intervention that maybe research suggests isn't quite as effective, but it's still very effective, but it uses considerably fewer resources. So sometimes that's a better choice. In some situations, if you remember, those of you who took the 603 class with me, and we did the general case instruction matrix or planning sheet. And the purpose of that is to identify behaviors and then to look at the efficiency of a behavior. So when you complete an efficiency matrix, you look at the level of reinforcement, the frequency of reinforcement, and the quality of reinforcement for problem behavior, and you compare that to what you need to establish for the alternative behavior. The reason that's used is it helps individuals who are actually in the setting, it helps them understand why we need to respond to new alternative behaviors with the level of intensity that we have to. And I found that it's extremely helpful, and the extent to which I can get people to buy into interventions is a lot greater once they understand that. Well, the same thing applies to target behavior sometimes. So you can use a tool or a matrix and have different individuals rate behaviors based on a number of criteria, and then use that as information to prioritize target behaviors. So an example would be something like this. Let's say we have three individuals doing the ratings, and then we have, for each behavior, we consider four different questions. So the first question was, does this behavior pose a danger? So that could be a danger to that person or to someone else. And you could independently have people rate on a scale of 0 to 4, with 0 being no danger at all and 4 being this is an imminent and immediate danger. How long standing is the problem or the deficit? So is this a problem that's occurred over a long period of time, or is this something that has cropped up recently? It could be that if this is something that's only occurred recently, it's related to some temporary motivating operation. And if that's the case, it would be worth looking into, okay, what is this motivating operation? And is it something that we can um, we can make some changes to correct, or is this something that's going to just pass with a short period of time? If it's a long-standing problem, though, chances are that this problem is not going to get better unless some intervention takes place. So you have people rate their perceptions there. The next question is, will changing this behavior produce higher rates of reinforcement? And what we mean by that is, will that person be able to recruit natural reinforcement at higher rates? In other words, is it functional for that person? Would be another way of saying that. So you have people rate their perceptions once you explain what that means. And then how likely is the success in changing this behavior? And this is sort of a measure of people's commitment and the likelihood that they think an intervention is going to be successful. So it's not that this is hard and fast and that you would use this as an exclusive way to prioritize behaviors, but it is a good way sometimes to get some discussion started. So rather than having people rate these privately, you could do it in an open meeting. And and then what you can see is if one person rates this as a very high priority, another person is a very low priority, that's a good discussion point. And you can talk about, well, why do you think this is so important? And then the person can give feedback, and then the other person, I didn't consider that. I don't really see it because in my situation that's not an issue, but I can see how in your situation that would be important. So sometimes establishing communication as part of the planning process can be really helpful in avoiding problems later on. Okay, in this section, we're going to talk about, review some aspects of inter-observer agreement, and then introduce a few new concepts. So, again, as this is something that you're aware of, what I found in my own experience working with folks is when I try to review inter-observer agreement, people sometimes get a little, yeah, okay, we know this. And with undergraduates, you get some eye rolling sometimes. Then, when I ask people to apply it, when I'm working in the field and we've collected data and I'm working with students and I say, okay, compute inter-observer agreement, very often they'll use the wrong formula or they can't remember, they'll get some aspect of it wrong. So there are several ways of approaching inter-observer agreement, and there are a number of things that you need to consider. There's also a few more advanced issues that we're going to introduce here. So based on what we've already discussed, we talked about observer drift, remember? Um, Calculating inter-observer agreement at the beginning of data collection ensures that you're actually you have a good definitions of behaviors, and you have a good procedure for recording data. Because it's reliable. Two independent observers are going to record the same thing or something very close to the same thing. It's important to continue to collect inter-observer agreement to assess for observer drift, because observers we get that some individual changing definitions over time. Also, sometimes you have new individuals come into the data collection process. This happens in research studies, and it certainly happens in applied settings. And it gives you a way of comparing this new observer's data collection to the existing data collection. So in computing inter-observer agreement, of course, both observers have to be using the same measurement system, same data sheet. If you're using interval recording, the two observers need to be using the same timing mechanism. So you can either have something that's audible, or that's typically not desirable in a classroom setting. So using like earbuds with a Y splitter so that both people can hear an audible tone at the end of the interval is usually something that you do. That gets a little tricky because the observers can't see each other's data sheets, so you have to be far enough apart so that you are actually observing independently, which is number three. Independent observation means that one observer can't see the other. So then the observers measure the same event. They need to be recording the same behavior. And again, this can be a little bit tricky too because the observers have to be sitting so that both people can see and observe the behavior that's being recorded. So in reviewing different methods of computing inter-observer agreement, there are three broad categories. There's event recording, IOA, time or duration recording, IOA, and time sampling or interval recording, IOA. Within each of these three categories, you use the same formula with some variations on it. So we'll talk about each of these areas and review how IOA is calculated. So with total count IOA for event recording, this is the simplest. The formula for frequency and actually for duration and latency is the same. It's smaller number over larger number times 100, and that gives you percentage agreement. This is the simplest. It's not a great measure for a number of reasons. One of them, it actually overestimates the actual agreement. Because what happens, I mean, if you think about it, what's happening here is you have a period of observation, let's say for 30 minutes, or one class period, 50 minutes, and two observers are recording the frequency of a behavior. One person says it happens 8 times during that hour, the other person says it happens 10 times during that hour. Of course, 8 divided by 10 times 100 is going to be 80% agreement. In reality, though, the two people could agree on much less than 80% of the recordings. In other words, one person could be recording, 8 times that don't coincide at all with the 10 times the other person recorded. So the actual agreement in reality could be zero, and you're going to get an 80% agreement just because you're basing it on the total number of occurrences. In reality, that's not going to be that bad, but it is a less sensitive measure than some of the other measures. But for frequency data, it's acceptable. It's certainly acceptable for clinical data, and for some research studies, but for a highly controlled, higher level research study, you're going to want a more precise measure of inter-observer agreement. So if we practice this, we have one observer records 27, the other records 40. So if we take 27 divided by 40, I actually have to use a calculator. I'm not that good anymore. Where's my calculator? Sorry. So 27 divided by 40, that equals 0.67. So that's going to be, about 67% agreement, which would not be acceptable level of agreement with the standard of 80%. And if you also consider this method of computing inter-observer agreement is less sensitive, then this is actually pretty low. With duration and with latency, measures of time, the same formula applies. So in this case, it would be shorter duration over longer duration, or with latency, it'd be shorter latency over longer latency times 100. So if you think about it, with different measures of inter-observer agreement, you're simply using the information that you have to calculate inter-observer agreement. Like the calculation with frequency. This is not a super sensitive method. Again, all you have is at the end of a period, one person records that the behavior happened a total of 30 minutes. The other person records that the behavior happened a total of 45 minutes. So you get 30 minutes divided by 45 minutes times 100, and that's going to give you the percentage agreement. You don't really know how many of those minutes the two observers were actually recording the same thing at a specific point in time. All you know is at the end of the game, this was a total measure you got. So again, this is acceptable for duration data, but it's not the best. You can improve these measures by using the mean count per interval event recording. So what you're doing here is it's basically giving you a little more sensitivity in a measure of agreement. So while you're not doing interval recording, this isn't considered interval recording, you're doing event recording with a session that is subdivided into smaller segments of time. So let's say that you are observing for a 1 hour session and you're doing frequency data. With this method, you would divide your 1 hour session into, let's say, 4 15-minute chunks. I'm going to call, because when I say interval, it's a little confusing because we're not really doing interval recording. We're doing frequency recording within smaller chunks of time. So if I have 4 15-minute chunks and I'm recording the frequency within each 15-minute chunk, and another observer is also recording the frequency within each 15-minute chunk, we can calculate our agreement by smaller number over larger number times 100, but instead of doing it at the end of the entire session, which is 60 minutes, now we're doing it for each 15-minute piece of each 15-minute chunk, and then we can average those out. So we'd add those percentages together and divide them by 4, and that would give us the mean count per interval IOA. So as you can see, what this does is it gives us a little more fidelity. We can see, in other words, if the two observers are just not really recording behaviors at the same time, but just one at the end of an hour ends up with 3 and one ends up with 2, you can pinpoint where the behaviors actually occurred, at least down to a 15-minute chunk of time. So it's less likely that you're going to get an artificially inflated inter-observer agreement number using this method. So this would be preferable to just doing, a recording at the end of every total observation, which might be 60 minutes. Also, if you think about it, this method fits in really well with the way we work, especially with younger children. Academic periods or class periods or activity periods are going to be shorter chunks of time. In most applied settings, also some variation of this method is used just to collect data. So even if we're collecting frequency data, we'll do it by periods of the day. Very rarely are you going to have someone just collect frequency on a sheet for the entire day without knowing at what time that behavior occurred. So this method of doing inter-observer agreement would fit in with that method of data collection really well. And it actually gives you quite a bit of improvement in the accuracy of that inter-observer agreement measure. This is just a little practice here, not that you actually would need to do it. So here we've got 5 intervals of time and we have 2 observers. So we would compute percentage agreement for each of these pairs. So the first would be 2 divided by 3, 3 divided by 3, which is be 100%, 1 divided by 2, 50%, 3 divided by 2, and 1 divided by 4, which would be 25% agreement. So we take all of those percentages, add them up, and divide them by 5, and that would give us the average mean count per interval. A variation of this, just like the formula for computing IOA for the entire session for duration is the same as for frequency, This method can also be adapted. So instead of having a total duration for the entire day or observation period, you're breaking the observation down into chunks of time, and then your inter-observer agreement would be based on two observers, measures of duration for each chunk of time. So the same way that you're improving the fidelity of or the accuracy of the frequency IOA, this has the same effect on the duration IOA. It's going to be more sensitive, um, because it's simply the fact that you might have an inflated score at the end of an interval is minimized. There's another method of computing frequency-based inter-observer agreement that came out of criticisms of that small number over larger number for an entire observation period. Um, and it's the most stringent method of computing inter-observer agreement for that kind of data. And I actually don't see it used that often. Um, Sometimes in clinical settings you might see this used for research, but rarely in school settings. So what you do with this is you take an observation period, a period of time, you break it down into intervals. So in this case we have 5 intervals. Let's say that each of these intervals is 10 minutes. So this is a 50-minute class period. And observers record frequency within each period of time. So within the first 10 minutes, observer 1 recorded 3, observer 2 recorded 1, and then second 10-minute interval, observer 1 recorded a frequency of 4, and observer 2 recorded a frequency of 4. So with this method, instead of computing a percentage for each interval, you simply indicate if the observers agree exactly, yes or no. So it's a binary system. So of course in that first interval the observers don't agree, the second intervals they do, and then they don't for the third or fourth, but they do for the fifth. So you would get 40% agreement out of all those data. Well, as you can see, this is a lot more conservative than simply doing percentage agreement overall. Or even it's more conservative than that second method where we report a percentage for each interval. I like the second method. I think it's a good compromise. It gives you better data. I think this method is overly stringent, and it doesn't give you. It's just too harsh. So, I guess the under some conditions when you had to ensure a very high level of fidelity and agreement with your data, this might be a method you would choose. Um, I would probably go with another method of recording if I were doing this. And I'll explain why in a second. So be aware that this is a method that's sometimes used with frequency data and it's very conservative. So this is just a little practice. Again, you may choose to just do this on your own time, but in this case we have 10 intervals. So essentially, how many of these intervals, when you look at the list, do the two observers agree? Exactly. And as I look over, I see 1, interval 3, they both said 5, and I think that's it. So we would have 10% agreement based on that method. So what you may want to do just for kicks is compute the actual percentage for each of those 10 intervals. So that would be the other method. 1 divided by 3 would give you 33% agreement. Of course, 4 divided by 4 is 100% agreement. Oh, there were 2. I'm sorry. So you'd have 20% using the first method. I missed that one. So you could compute the percentages for each one and then average those, and that would give you that average occurrence. And then you could use the more primitive method. Just add up everything for observer 1, add up everything for observer 2, smaller number divided by larger number times 100, and what measure would that give you? So it'd be a good exercise for you to compute inter-observer agreement using all 3 of those and just see how they differ from one another. So let's talk about a different situation. Suppose that for your research study, you are assessing the effectiveness of an instructional method, and the instructional method uses discrete trial instruction. So you have discrete learning trials, and it's set up so that the student's either making a correct response or an independent response, or it's not a correct response or it's not independent. So it's a binary 0 or 1. And you're graphing the percentage of trials in which the student was independent. So when you can calculate inter-observer agreement with that method, you use the data you have. So in this case, did both observers indicate that the student was not independent on trial 1 or trial 2? And then on trial 3, observer 1 said the student was not independent or wasn't correct, and then observer 2 said that the student was. So with this type of data, you're simply recording, do the two observers agree on that trial, yes or no? So in this case, the two observers agreed on 2 of the 6 trials, so you calculate it, the formula is the same as the other, so it's smaller number over larger number times 100, or the number of agreements over the total number of trials, really, is what we're doing here. And this case is 33% agreement, which is pretty low, especially for something like this. So here's a practice opportunity with trial by trial. So of these 6 trials, on how many trials do the two observers agree? And when I look at this, I get 0 agreements. So of course, if we look across trials, we're going to have 0. Okay, this method should be familiar to you. This is interval by interval. So this is another formula. This is the first method that uses a different formula completely. So here with momentary time sampling, with partial interval, or with whole interval recording, with any of those methods, you're actually recording or you're looking at observers and you're comparing each interval one at a time. This is Now what you can see is the method of those other methods for frequency data were trying to borrow some of the sensitivity of this method and applying it to frequency data. So that's what they were doing. This is more sensitive, and it is because for each, you actually know in each interval you have those checkpoints. So if you have 20-second intervals, you get every 20 seconds you're getting an assessment of whether the two observers are recording the same thing, as opposed to at the end of an entire observation we're taking total numbers and comparing them. So you actually know for each entry whether the observers agree or not. So those other methods of adapting frequency recording are borrowing some of the sensitivity from this method. And of course, as you probably remember, it's point by point agreement means that you look at each interval. So here I see an agreement at interval 1, I see an agreement at interval 4, I see agreement at interval 6 and at interval 9. So those are intervals where both observers either record an occurrence or a non-occurrence, and they're saying the same thing. And of course you calculate this by taking the number of agreements divided by the number of agreements plus disagreements, or the number of total intervals, and multiplying that times 100. So here's a little practice for you. So of these pairs of intervals, how many agreements do you see? I see 4 agreements. I see an agreement at interval 4, 6, 9, and what would be 12 if they were numbering continued. Doesn't for some reason. So then of course you take the number of agreements, divide those by agreements plus disagreements, or total intervals. And in case we have 12, and times 100 would be percentage agreement. Okay, these next two methods we're going to talk about are variations of point-by-point interval agreement, designed to take care or to address some problems that you run into. This kind of method of computing interobserver agreement can give you inflated scores in two situations. Let's say that you have a behavior that occurs at a very high rate. In other words, just most of the time it's just happening. Or you have a behavior that's happening at a really low rate, like just very rarely happens. Um, you can get inflated scores. So think of it this way. Suppose that one observer was wearing a blindfold and just recorded an occurrence every single time. The other observer was very carefully observing and recording. And let's say the observer who was recording very carefully for 10 intervals recorded the behavior occurred in 9 of those 10 intervals. The person who was wearing a blindfold and listening to Led Zeppelin just recorded every time. So if you calculate that agreement, you're going to get 9 agreements over 10 agreements plus disagreements times 100. That's going to be 90% agreement, and one person wasn't even observing. So that is inflated because, again, because the behavior was happening at such a high rate. A way you can control for that is you can use a method of recording IOA where you only count intervals where at least one of the observers recorded an occurrence. If no observer recorded an occurrence, then you don't count that interval. So in this case, you're counting intervals 1, 2, 3, 4, 5, 7, and 8. You're not counting interval 6 and 9 because no occurrence occurred. So you're basing your total number of intervals on an interval where at least one person recorded something is happening. So this is called occurrence agreement sometimes. And often what researchers will do is they'll report 3 measures. They'll report overall agreement, which is that first formula. You look at all the intervals. Then they'll report occurrence agreement and non-occurrence agreement, which we'll talk about in a second. So again, with this one, you're just simply not counting those intervals. So this would be occurrence agreement. And this would be an opportunity to practice it. So of these intervals, if you were only counting intervals where one of the observers, at least one of the observers recorded the occurrence, how many? So take a second and do this. Let's do this together. I get 9. Did you get the same thing? So during at least 9 of these pairs, one of the observers recorded something. So what you do is those intervals like interval 4, interval 6, and interval 9, where no one recorded an occurrence, you simply disregard those. You can mark them out. They're not involved in the calculation at all. You're only using your calculation on the intervals where at least one person recorded something as occurring. So this method, I may have misspoke earlier, you would use this if it's a low occurrence behavior. In other words, in this case, if I just put zeros for everything, I'm wearing a blindfold, I'm listening to Led Zeppelin music, and I'm just putting zeros for everything. Another person is observing and they see the behavior happening during 2 intervals, and then they have zeros for everything. With 10 intervals, our agreement's going to be 80%, even though I wasn't even observing. So it's artificially inflated. So by not counting intervals where neither of the observers recorded an occurrence, I'm adjusting for the low rate of the behavior, and it's going to be a score that is not subject to the same level of inflation. This is another variation, and this would be with a really high rate behavior. In this case, you don't count intervals. So with this method, you're only counting intervals where at least one of the observers recorded a non-occurrence. You're throwing out, again, for purposes of IOA, you're not throwing out the data, but you're basing the inter-observer agreement score on the intervals when at least one of the observers recorded a non-occurrence. So if both recorded a non-occurrence, or one recorded an occurrence and one recorded a non-occurrence, you're counting those intervals. So in this case, you're going to disregard, for purposes of IOA, intervals 1 and 4, and you're going to base your data on the remaining interval. I'm sorry, 1, 4, and 9. Getting messing that up. I'm sorry. You're going to eliminate 1 and 4 because they both recorded occurrences. Sorry, I've been doing this for a while. So your IOA is going to be based on the intervals that are filled in color. And you're going to count agreements and non-agreements. So here we have 2 agreements. We have agreements at interval 6 and interval 9. And then we have 1, 2, 3, 4, 5, 6 total intervals. So 2 divided by 6 times 100 is 33% agreement. Now, of course, you see how if we had included those intervals where both observers recorded an occurrence, that's going to be a higher score. So as I said before, this is another way. So sometimes what you'll see is 3 measures of IOA. You'll see overall agreement. If the behavior happens at an unusually high rate or an unusually low rate, you'll see these other measures used: occurrence agreement and non-occurrence agreement. So these are variations that control for that inflation. Often what I'll do if I have some data is I'll compute the overall agreement, and then I'll compute these other 2 methods as well. And if all of them are pretty close to each other, I only include the overall agreement. And then if the reviewers ask for something else, I can say, well, I calculated them and they were about the same. So they're not always used. If they're used, it would be a reason. When I did my master's thesis, I was observing staff in a residential facility for adults with significant disabilities, and I was measuring the occurrence of positive praise statements or reinforcing statements they made to the residents there. And it happened at an extremely low rate. So out of an hour observation, I might get 3 occurrences. So think about it. And I was using partial interval recording. And so if I used these methods as well, because if I just used the overall method, again, one person could just have been, zoning out and just recording non-occurrences for everything, and then it would have been extremely high percentage agreement even if one person wasn't attending. Let's talk a bit about defining dependent variables, in particular related dependent variables to response classes. When you start doing research, you're actually paying a lot more attention to definitions and target behavior definitions than you would in regular clinical practice. Clear definitions are important for replication. So if someone's going to replicate a study, they need to be able to define behaviors in such a way that they know they're measuring the same thing as the researchers in the study being replicated. And we've talked about the importance of replication in single case research. Replication is very important for external validity, the extent to which we can apply our research finding to other settings. So it's critical to spend a lot of time on, be very particular about the way you're defining your behavior. Another reason is when we start doing practice inter-observer agreement sessions and we try out our data collection system, it's very common even for experienced observers to get very low inter-observer agreement. the very first time. What you end up doing though, the first thing you want to adjust is the definition. Often what we'll find is if we tweak the definition of the behavior and change it, and we learn that just by getting really low IOA, and then you talk with the other observer, okay, you recorded this as occurring and I didn't. Why did you record that as occurring? And the person explains his or her reason, and you sort of have some discussion and you fine tune the definition. So it actually pretty quickly, with tweaking the definition, you can usually get the inter-observer agreement to be really high. So when you actually start doing research, be prepared to adjust your operational definition. There are two broad types of definitions for dependent variables. One is function-based and one is topography-based. Of course, function-based, as you remember from 603, is going to be based on the function of the behavior. So if you have a challenging behavior that serves some operant function, and then we may have different forms of that behavior. So the person may engage in different types of behavior, all for the same purpose, let's say to escape demands. Well, the word that should come to mind to you is response class. So function-based definitions include all the members of a response class. So if you're doing research on teaching alternative behaviors, very often you'll have function-based definitions for your target behaviors, and you want to record the frequency of the target behaviors and the frequency of the alternative behavior that you're teaching, and what you hope to see is that as one increases, the others decrease. The other type of definition is topography based. So topography on a map is the shape of the land, and topography based is the shape or form of the behavior. So topography based behaviors are probably more common in research because we're looking at specific behaviors. For example, I know if several of you are doing research or developing research proposals to address stereotypy. So with stereotypy, you very well may have very specific topographical descriptions of what the behavior looks like. And of course, we'll use function-based interventions when our research question is related to behavioral functions. And we're looking at the impact of something like an alternative behavior or an intervention on a response class. As you develop interventions, regardless of the type, simple, concise interventions are usually better. Of course, other reasons. When would it be advisable to use a function-based definition? Well, some of you have done or are really doing research proposals related to precursor behavior. With precursor behavior, we're looking at behaviors that might precede some more severe form of behavior. And often we can do a functional assessment on those precursor behaviors, and if they're part of the same response class as the major problem behavior, then you can actually get functional assessment information without that other behavior occurring. And then sometimes the more severe form of the behavior is really dangerous. Like, of course, with kids, with elopement, young kids running out of the building, or severe aggression. And if we can identify other behaviors that are within that response class, we can, and of course this applies to low rate behaviors as well. Sometimes really severe behaviors are low rate, but there are behaviors within the same response class that occur more frequency, so we can get more data to determine behavioral functions. The same thing goes with assessing interventions. Sometimes looking at the frequency of occurrence of those other behaviors within the same response class can be very informative, especially with teaching alternative behaviors. What's actually happening with an alternative behavior, if you may have figured this out by now, you're simply adding another member to the response class of behaviors that include the challenging behavior. and there's covariation within functional response classes, so that if you have one behavior in a response class increase and it's actually functioning to meet the person's needs, the person doesn't have the need to engage in the other behaviors. So um, typically when function-based definitions are used, it's an intervention that is associated with um, functions of behavior in response classes. Other research questions require topographical definitions. So when do you use those? Well, sometimes during a research study, we may not even know the real function of a behavior. Or sometimes we're actually concerned with changing the topography of a behavior. So we may know the function, but we're interested in, especially for more severe behaviors, we want to know how many times these are occurring, or we want to know the impact of some independent variable that we're applying. So we actually base the definition on the form or what the behavior looks like. Topographical definitions are also important if we want to improve the quality of a student's response. For example, a student could um, have a communication behavior. I'm sorry, somebody returned a phone call to me. So the point was sometimes the form of a behavior may serve, may be functional, like if a kid's communication, like pointing at something and growling, pointing to a toy, is clearly a communicative behavior, but saying the name of the toy or pointing to a picture of the toy is a preferred method. So a topographical definition would let us know if within that response class the student is actually making a desired response. When you establish target behaviors, you want to look at accuracy, completeness, and conciseness for each of the categories. So does the definition accurately define the behavior that's relevant? Is a definition complete enough? Does it encompass the the range of examples that an observer might encounter? So that's where we get with the inclusiveness. Um, Sometimes when you have definitions like social skills, they have to encompass a range or maybe a response class. So examples and non-examples can really simplify the process. So you would have a description of a definition like a social initiation would, you would say, a child approaches another child and communicates, and you could give some examples and then some non-examples. Like what would you consider a social initiation? Like going up to another kid, and pointing to a toy and holding out your hand, like is this their simple request, you would count that as a social initiation. But walking up to another kid and snatching the toy out of the kid's hand would be a non-example of a social initiation. As you've heard before, in behavior analysis, we like to be objective. So that means that when we're defining target behaviors, we always talk about behaviors we can see, behaviors that are observable. Now this is interesting. When I was at the Association for Behavior Analysis annual conference back in May, I went to a session on ACT, acceptance and commitment therapy. And it was a panel discussion of three researchers who are doing research in ACT. And one of the questions came up about, well, what about target behaviors? And it wasn't so much for research as it was for billable insurance claims. And all three of them said, we've made absolutely no change in the way that we define behaviors. The target behaviors are the same. We're talking about problems and issues that are relevant and they're observable behaviors. We're just implementing an intervention that's different. So even though the intervention with ACT talks a lot about internal processes and non-observable verbal behavior, The outcome measures are always observable. They're always things you can see. And I've noticed that, or I've tried that, that's been something I've tried to be very careful about in working with research on anxiety, is that if we're talking about anxiety, we define observable behaviors that are associated with anxiety. So it's things that the person's actually doing. So when I look at your definitions in your method sections, I'm going to look for clear definitions. They're readable, they're not ambiguous, they're complete, they define the boundaries. And again, examples and non-examples are useful in some situations. Focus on topography or function, and sometimes you pull in a little bit of both, and refer to observable behavior. So when we talk about observation systems and inter-observer agreement, they're all built on the foundation of a good, well-defined target behavior. So when you have clear, well-defined target behaviors, it enables you to be very precise in describing your data collection methods. It enables you to be reliable, or you can have high agreement between two or more observers. They're much more likely to get it with clear definitions. It greatly increases the accuracy of the recording you do when you have clear, concise, objective definitions. And the extent to which your results can be replicated is enhanced with clear definitions. So it's critical to all the different variables we've been talking about. Once you develop a definition, there's a real quick little test you can give. First one is, can you count the number of occurrences? If you can't answer yes to that, go back and look at your definition again. You should always be able to count when a behavior has and has not happened, or if it is and is not occurring. Second one is, will a stranger know what to look for based on the definition? So in other words, if you just give this definition to someone and say, go into that room, observe that participant, will they be able to identify an occurrence or non-occurrence of a behavior? If the answer isn't yes, look at your definition again. And finally, can you break the target behavior down into smaller, more specific components? The answer to this should be no. Your definition should include the basic component of that behavior. If it isn't, then you need to break down your definition more. So what dependent variables have you settled on for your research? When you compare them to the criteria we've been discussing, how do they match out? Are you basing your definitions on topography or function? And is there a good reason for the choice you made? Is it clear that your definition is observable? Can you count the number of occurrences? Could another person who's not familiar with your participant observe and record the same thing you would record? So this is a good time, even with just your definitions, to share them with someone else. Ask if they're clear. Ask if the person would know what to record. And of course, knowing that if you actually start doing the study, be prepared to change it. I have rarely not changed a definition once I started actually conducting a research study. Of course, another factor with dealing with target behaviors or dependent variables is when selecting a criteria for behavior change. So one of the factors, of course, that could be because it's important for the person, it increases skills, decreases undesirable behaviors, but then also is something that's valued or meaningful with other people, with society in general, or with the people who are close to that person. Of course, if you're using a changing criterion design, this is a critical piece not only for the intervention, but also in the way in which the design demonstrates a functional relationship. Having clear criteria for or goals for behavior change also helps you define when the intervention should be terminated or when should you um, start focusing on some other aspect of behavior change. There's a number of approaches for setting a criteria for the level of behavior that should be acceptable. One of them is observing someone who's highly competent, someone who's an expert in the skill, and using their level of performance as a standard. Um, a variation of this would be someone who is a peer that has mastered the skill. That's not quite as high of a bar, or someone who's successful. So when I was working with adults with disabilities and training vocational skills, rather than some worker that did not have a disability, I would typically use peers who had mastered a skill and who were performing a job at a level that supervisors regarded as satisfactory or uh, exceptional in some cases, and that was the criteria against which we set our performance criteria, and that worked a lot better. Another way is you can set tests of different levels of performance and assess which one is going to get the job done. So sometimes in job settings you might do an efficiency analysis. You might look at what rate of production are you going to get the best results. For example, I was teaching young adults with disabilities to stock grocery store shelves, and this was fairly new in my career, so I was simply, okay, the faster we can get this done the better. So I was looking for speed. Well, what happened is the shelves were getting stocked quickly, but the grocery store manager was saying, this looks like crap and I'm going to have to redo this. Is this the best you can do? um, and it really did. They weren't spaced very nicely. They wanted it done in a reasonable amount of time, and they wanted it to look really nice. So the criteria was of placement, and it was where the items evenly spaced and where they so the same distance from the edge of the shelf was important, not just time. So what factors are important for the outcome that you're trying to achieve? And I'm not going to have you do an in-class activity since we're not in class together. But again, this may be something you would want to check out. So what we've accomplished, or uh, I hope we accomplished in this presentation, and I know it went longer than I thought, but we reviewed some aspects of defining behaviors. We looked at inter-observer agreement, and we looked at the quality of uh, our observation systems. And this is information that I hope is going to be helpful to you as you work on your method section assignment. So as you start filling in those details, write questions, write down things as they occur. And then if you need to, you can set up a time to talk with me individually. You can certainly email me with questions. If I can give you a quick answer to your email, I will. Otherwise, I might ask you to set up a time to speak with me. Sometimes it's easier to address these issues in a discussion because it can get a little complicated in a series of emails, and it's just sometimes more time efficient just to talk about it. So good luck with everything, and don't forget to ask questions if you need to.